Hello friends. Today I am going to tell you story of a brilliant teenage girl, Anaya. Anaya was very nice till the 8th grade. She was intelligent and was also very skilled in sports and other art forms. She had also received a scholarship in the 7th grade and had secured the first prize in an inter-school elocution competition. She was so enthusiastic and jolly that everybody loved to be around her. Not at home, not only at home, but also in the school. But since the last 6 months, everything changed. Her behavior changed. She started lagging behind in studies. She also started isolating herself and got irritated by trivial things. She sat be alone herself in her room and cried. She was living under some kind of pressure. She sat alone thinking for hours together. Isha, her mother, thought that Anaya's menstrual cycle had begun and this may be the reason behind her behavior. And the reason, according to her, may be the hormonal changes. But the situation worsened day by day. She refused to go to school. She also vented her anger on her younger brother. And as matters worsened, she also raised her hand against him. Her appetite decreased. She was unable to sleep almost till 2 a.m., 3 a.m. at midnight. At last she took experts' advice and she was diagnosed to be suffering from depression. Her mother, Isha, was also suffering from depression, but she was fine now. Depression and anxiety in teenagers is becoming a serious issue in today's world. Depression and anxiety in teenagers is becoming a serious issue in today's world. Treatment for these disorders can be more effective if they are diagnosed sooner. It is the parents and teachers' responsibility to seek experts' advice when the symptoms of these disorders are observed. The personality is in a developing stage during adolescence. It is flourishing in all aspects. Energy level is high, very high in this period. But children often have many confusing questions like, who I am? Who am I? Do I lack something that the others possess? What is my role in this circle of life? Why do I face domination by my parents? What is the meaning of male-female relationships and what is gender? In such situations, whether it's due to an upset mood or an anxiety or depressive disorder could be deduced only by an expert. It could be a tricky thing. It's not the case that every teenager will appear to be sad, prima facie. Due to this, depression may be neglected. Irritedness, violent behavior can be seen in most of them when depressed. The following symptoms are seen in this disorder. Number 1, feeling anxious and irritated. 2, feeling of guilt and uselessness. 3, lack of enthusiasm and passion. 4, lack of concentration. 5, being over emotional and crying on trivial matters, then being lazy, behaving violently because of matters that are not even important, or least important, becoming violent for that. Then change in the eating and sleeping habits, tendency to be away from home, excess of watching television and playing computer games, not able to accept criticism and always feeling hurt. If somebody talks against them, they are not ready to accept. Isolating themselves and not socializing, this could be there. Headache and stomachache is experienced even though physician tells that nothing of that sort is there. Hurting themselves or feeling suicidal. All these things are there. Parents, teachers and friends must pay attention to the duration for which adolescents are exhibiting these symptoms and to what extent are they experiencing it. Also, adolescence is a phase in which changes are taking place. Therefore, these symptoms can be normal at times and are known as growing pains. Whether these are the natural changes or due to the disorders can be known only with the help of an expert. Most of the times, hyperactivity or rebellious behavior can be the symptom of these disorders. Effect of depression at this stage. What are the effects? There are school-related effects. Depression leads to lack of concentration and energy level. Absence in school increases, scores decrease. In short, those who are intelligent are not able to be like before. Then running away is there. They run away from home or at least talk about it indirectly. These all are emotional cries for help. Then weak self-image, feeling of failure, uselessness and guilt is formed. Eating habits hamper, that is excess eating, eating less, eating even if not needed, can also happen sometimes in case of depression. Then there could be internet addiction. Overuse of internet even if not needed. Constantly using the internet and playing video games. There could be physical injury. They try to hurt themselves, for example, trying to slit their wrists. Carefree behavior could be there. Most of the times, these teenagers are seen to be carefree. For example, it is seen while driving or when it comes to following the rules, society rules, civil rules. There could be violent behavior. In case of severe depression, when there is a tendency of hurting ourselves, violent behavior is observed. Most seriously, there could be suicidal tendencies. Due to severe depression, one can have suicidal tendencies or may speak about it or may even try committing suicide. Depression in teenagers is something that shouldn't be ignored. It shouldn't be ignored at all. Ignoring might solve the problems, blaming all of these on the age. These are all misunderstandings. Seeking experts' advice immediately is the best solution. Firstly, trust your children. Trust them and talk to them. Let them feel that they are loved and cared about. Let them feel that they are loved and cared about. Build a healthy atmosphere of trust at home. As and when needed, seek help from an expert. Let the expert decide whether the changes in the child's behavior are due to depression or not. no matter what the reason is. This kind of behavior must be corrected for avoiding problems in future. The main reason behind depression is chemical imbalance, or we can call chemical changes in the brain at synapses. Along with that, some reasons contributing to disorders are family history, that is heredity, trauma and other stress factors, failure in an examination, stress due to constant arguments between parents, failure in case of one-sided love, stressful atmosphere at home, stress due to the death of loved ones, then having misconceptions about success and life, then civil society situation in the society, terrorism and all these cases, corruption and all these things. It matters how you take all these things. Then if the personality is pessimistic, that is negative, poor image, self-image, or negative attitude towards life, this could be reason. Then physical conditions like serious health problems, early childhood trauma or such events. Depression can prevail with other serious disorders like schizophrenia, addictions, eating disorders. What are the solutions? There are solutions. Medication after seeking expert advice is one of the solutions. Along with that, psychotherapy, CBT, that is cognitive behavior therapy, and mindfulness-based cognitive therapy, MBCT, are also useful. These therapies are important while treating depression along with medication. How does psychotherapy, CBT and MBCT prove to be useful? What they do? They help to know what kind of behavior, thought process and emotions help this disorder to increase. They teach how to face the situations that are responsible for the disorders. They teach how to control your emotions, how to be happy and retain happiness. They teach the ability to adjust to situations and looking for solutions to the problem. They help in looking for the origin of stress, where the origin lies, what are the root causes of stress. Then one is taught to maintain a positive approach. Then setting of priorities or setting or changing of priorities is taught. They teach thinking step by step in an organized way and then acting accordingly. It changes the negative approach. Then there are relaxation therapies, positive regeneration imageries, clinical trance. These are some of the stress management techniques taught, both Eastern and Western. Then it teaches how to be healthy at every moment in the present, how to be happy, and how to handle the situation. Few meditation techniques are also taught which help the depressed to be at peace. What is the self-help to do in depression? How can you help yourself? Along with medicines and therapies, the things helpful to get out of depression. However, these things to be practiced after consulting an expert. Things like have a proper and balanced diet, start writing a depression journal to channelize your negative emotions, exercise a lot, especially aerobic type of exercises in which the pulse rate increases. It secretes serotonin, endorphins and antidepressants. Also practice yoga and breathing exercises. Listen to music every day. Start thinking positively. For example, the situation will change, days will get better, this shall too pass, and I'll be fine. Then be aware of depressing thoughts and fears are not real. Set simple targets, small targets, and try to complete them one by one. Try to inculcate the stress management techniques. If it feels that the situation is no longer under control, immediately seek experts' advice. Because of depression, a blooming personality faces restrictions. However, this can be avoided by taking proper actions on time. We can help people, we can help teenagers to live a beautiful life once again. Thanks. Good day.